Have you ever wondered how NSAIDs work and when to use them? NSAIDs, or non-steroidal anti-inflammatory drugs, are a popular choice for pain relief, inflammation reduction, and fever control. So how do we use them correctly? NSAIDs come in a wide array of forms and brands. Some of the more common oral NSAIDs include ibuprofen, mefenamic acid, naproxen, and acetaminophen. Each has its own brand names such as Brufen for ibuprofen or Synflex for naproxen. There are also topical NSAIDs like diclofenac diethylamine and ketoprofen, which come under brand names like Decloran and Fastum respectively. For eye-related issues, ophthalmic NSAIDs such as napafenac and ketorolac can be used, with brand names like Nofen and Ketro. The dosage of these medications can vary widely depending on the specific medication, the condition being treated, and patient-specific factors like age, weight, and medical history.
These are commonly available brands of NSAIDs in Pakistan as follows: Panadol for paracetamol or acetaminophen, Brufen for ibuprofen, Synflex and Proxen for naproxen sodium, Pozantan for mefenamic acid, Caflam and Voltral for diclofenac sodium and potassium, Feldene and Mitz for meloxicam, Brixin and Briax for piroxicam, Ecaripid for Lornoxicam, Starcox for etoricox-sib, Celbex and Moveril for celecox-sib. Also, topical NSAIDs are available as Dicloran and Voltrol for diclofenac diethylamine, Daufen for ketoprofen, Picam for piroxicam, Brufen for ibuprofen.
Always follow the dosage instructions provided by your healthcare provider or the instructions on the medication label. Typically, NSAIDs are taken with food or milk to reduce the risk of stomach irritation or ulcers. However, it's crucial not to exceed the recommended dosage or take NSAIDs for an extended period without medical supervision, as this can increase the risk of side effects. Speaking of side effects, NSAIDs can cause issues like gastrointestinal irritation, ulcers, bleeding, kidney problems, and even cardiovascular issues. Individuals with certain medical conditions such as peptic ulcer disease, kidney disease, or heart disease should use NSAIDs with caution or under medical supervision. Moreover, NSAIDs may interact with other medications. Hence, it is essential to inform your healthcare provider about all medications and supplements you are taking. In conclusion, while NSAIDs can be highly effective for pain relief, inflammation reduction, and fever control, they should be used wisely and under supervision. Always consult your healthcare provider before starting or changing any medication regimen, including NSAIDs. They can provide personalized advice based on your medical history and current health status. Remember, information is power, but using that information wisely is what truly makes a difference. Until next time, stay informed, stay healthy,